Good day everyone, I am Mallory Alcid, Bachelor of Science in Nursing. So today we will assess the heart or the precardium and the peripheral vascular system. So for most of the cardiac examination, the patient should be at the supine position. So first we will inspect the anterior chest for the pulsation, and you may or may not see the apical impulse, but my patient is just a child, so it's just easier to see the apical impulse. So first we will palpate the apical impulse. So this is to detect some abnormal conditions. So first we will locate the apical impulse by using our one finger pad. So it is located at the fifth intercostal space at the midclavicular line. So next, ask the patient to exhale, then hold it, and it aids the examiner in locating the pulsation. So exhale. Thank you. So next is palpate the across using the palmar aspects of your four fingers. So palpate across the precardium. So gently palpate the apex, the left sternal border, and then the base. Next, searching for any pulsation, if any present, note the timing. So next is the percussion. This is to outline the borders and to detect the enlargement. So first we will place our fingers, stationary finger, the patient's fifth intercostal space at the left side of the chest near the anterior axillary line. Then slide our stationary finger toward ourselves and continue percussing. So note the changes of sounds from resonance over the lung to dull or over the heart. So next is the auscultation. So we will identify the auscultatory areas. Where we will listen. So this includes the four traditional valve areas. Where is the second right enters space, the aortic valve area, then the second left enters space, the pulmonic valve area, the left lower sternal border, the tricuspid valve area on the fifth space around the left midclavicular line, the mitral valve area. So we will place the stethoscope and try to close your eyes briefly to tune out any distractions. Concentrate and listen selectively to one sound at a time. Then note the rhythm and the rates. Next is count the serial measurement, one after the other, of apical beat and the radial pulse. Next is identify the S1 and S2. The first heart sound is S1, the lobe, and the second heart sound is the dub, the S2. Next is listen for the S1 and S2. Focus on systole and then diastole. Then listen for murmurs. If you hear a murmur, describe it by indicating the characteristics like the timing, the loudness, the pitch, the pattern, the quality, and the location, radiation, and the posture. So I'm going to start looking at your upper extremities, and if you can hold your arms out, that would be great. And I'm looking for the color of the skin and also touching at the back of my hands to check the temperature all the way down to the fingertips as your skin is warm and the skin color is appropriate for ethnicity, and I do not use any pallor or cyanosis. And I'm looking also at your arms for any lesions or any abnormal, which is I do not see. And as I move down the hands, I also looking for your fingertips checking for the capillary refill by pressing on each of the nails and on both hands of the fingernails, and they are pink, which is normal. And I also checking the profile sign, which are looking right here. The angle should be less than 160 degrees. And I'm going to check the pulses. I'm going to start checking your radial pulse. So I'm checking the pulses. I'm checking them at the same time so that I can see if they are symmetrical, the strength normal, and I'm going checking the rhythm should be regular and the rate should be within normal limits. And then I'm going to move on the brachial artery. The brachial artery, I'm checking for the strength. The rhythm is regular and the rate is within normal limits. So that's good. And I meet up your upper extremities and I'm going to look down to your legs. So I'm looking at your lower extremities. First, looking at the color, which is appropriate for ethnicity. I'm looking also for any lesions or anything abnormal findings. So, and also touching the lower extremities first for the temperature is the back of my hands, and that came all the way down to the toes. And here the skin is more the way down to the toes, and I've checked for any abnormalities. And I'm also checking, looking if there is any venous pattern at the particular of the back of the legs is where you would look for any varicose veins, which is I do not see. Alright, and then I'm going to look at the toes. I'm looking for the color at the nails. The nail bed should be pink, and I'm also checking for the capillary refill. That should be less than 2 seconds. According to some authors, less than 3. According to the other authors, you can document as less than 2 or 3 seconds, or if it is very fast, you could document capillary refill is brief. And then I'm going to checking the pulses of the feet. Okay, there are dorsalis pedis. Dorsalis pedis. Here, pulses right here on the top of the toes, and I want to check the strength. The normal would be 2 plus. The rhythm should be regular and the rate should be within normal limits. So next, I'm going to check the post-trabeal pulse. So here's the So you have here the malleolus right here. The malleolus right here, that bone, and you want to slide your fingers right here. There's almost like a notch there, and that's where you're going to find that pulse. And I will check the both of this, and I do that at the same time so I can check symmetry and would be good. And again, you're checking the strength. It's normal. The rate is within normal limits, and the rhythm is regular. Okay, good. And that concludes our assessment of peripheral vascular system. Then after the assessment, I will document all the findings. So now I will present all my findings. So first at the heart or the precardium assessment. So apical impulse rate is 100 beats per minute, and the radial pulse rate is 95 beats per minute, and the heart murmurs is normal sounds because it is made as the blood is pumped through the heart chambers, the valves and the arteries like whooshing or swishing noise. So next is for the peripheral vascular system findings. So the skin is warm, which is normal, and the skin is appropriate for her skin color is appropriate for the ethnicity, and no abnormalities or any lesions is none, and the fingernails and the nail bed is pink, which is normal, and her radial pulse rate is 95 beats per minute, and the rhythm is regular, and the brachial pulse rate is 88 beats per minute, and the rhythm is regular, and the dorsalis pedis pulse rate is 87 beats per minute, and the rhythm is regular, and the post-tibial pulse rate is 89 beats per minute, which is regular. The rhythm is regular also, and which is this is normal. And that's all. Thank you.